Now, when we decide to treat, what is the typical plan of action? First step is to get an ultrasound. This will tell us where those varicose veins are coming from. It is crucial to get that information. When we treat the source of those varicose veins, the chance of getting a recurrence goes down drastically. In this day and age, procedures for varicose veins are done under simple local anesthesia in over 95% of the cases. What this means, no need to go to the hospital, no need to be put to sleep, no need to have a needle in your back for spinal anesthesia. We just put numbing medicine where we have to work, and that keeps the patient very comfortable. What type of results can we get? Here's an example. Patient who had a treatment of his main superficial vein with a technique called radiofrequency, and at the same time we went ahead with what's called a microphlebectomy, little punctures, to go after those lumpy veins at the surface. Now, here's a picture taken approximately 3 months after the procedure. Another example, more impressive varicose veins here, but the same principle. We sealed the main superficial vein with a technique of radiofrequency, a little radiofrequency catheter, and we also carried out at the same time a microphlebectomy for those lumpy veins on the surface. And here is the appearance of the leg approximately 3 months after the procedure. So the treatment of varicose veins is simple, relatively easy, and covered by most insurance plans. Yes, men get varicose veins as well. We just have to learn to be more proactive when we develop symptoms from those varicose veins. Thank you for your attention.